All right, 11 o'clock, we're calling the meeting to order. Join me in the pledge. Pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
A moment of silence for our folks that are protecting and serving out there, both domestically and abroad, and making sure that we can have this meeting in peace. Thank you. Need a motion to approve the November 1st meeting. Motion by Legislator Greco, second by Legislator Klein. Any additions, deletions, and corrections? Hearing none, all in favor say aye.
Aye.
Any opposed? Stands approved. PS1 is a budget modification for the Sheriff's Office. This is Operation Stone Garden in the amount of $100,000. Motion by Legislator Chesborough, second by Legislator Greco. Any questions? All in favor say aye.
Aye.
Any opposed? Stands approved. PS2 is a budget modification in the Sheriff's Office. It's for Selective Traffic Enforcement Program in the amount of $10,080. Motion by Legislator Trudell, second by Legislator Klein. Any discussion? All in favor say aye.
Aye.
Any opposed? Stands approved. PS3 is an authorization to allow the chairman to enter into an agreement for 2022 for the Stop DWI program. Motion by Legislator Klein, second by Legislator Greco. Discussion. All in favor say aye.
Aye.
Any opposed? Stands approved. PS4 is a resolution increasing the probation revenue and expenditure lines for the JRISC service. This is in the amount of $24,800. This is the 20% that we had to, we thought we were going to have a reduction. Now we're back to full funding again. Motion by Legislator Chesborough, second by Legislator Emmons. Discussion. All in favor say aye.
Aye.
Any opposed? Stands approved. PS5 is authorization, the retention of an auditor regarding drug task force accounts. I would entertain a motion for this by Legislator Emmons, second by Legislator Klein. I've asked for this resolution to be put onto the docket. As we know, we're doing some changes in the drug task force, and I'd like to see an audit, a complete audit done prior to the Sheriff's Office taking over the those accounts, or, well, that function. Any questions? All in favor say aye.
Aye.
Any opposed? Stands approved. All right, on to department reports, EMO and EMS.
I'll get started and you can finish it. I think I reported out that we had our reception center exercise with FEMA evaluated at the fairgrounds in October. That went very well. FEMA was happy with the process there. We should get a after action report soon. We still haven't gotten one from our October and September exercises as well. We also had a medical service exercise, which is a radiologically contaminated patient in the general public, which is a partnership that we did with Oswego Fire Department, played the EMS crew, and Oswego Health Hospital participated in that as well. And FEMA overall was happy with that, so that went well. A couple of things. We still continue to support the health department with COVID-19 response, and we do the weekly conference calls that we've been doing. I think Renee just ordered, or is ordering, some additional PPE, some gloves, I believe. The other thing is the RFP that we had out for the medical director wasn't complete, didn't include any pricing, so we're still working with purchasing to get that piece submitted on their side. So that might be into January before we get that before you guys to review. The last thing, and I figured Renee would expound on this, but I just wanted to personally say thank you guys for the county legislator and the county administration for pushing forward with the support for the increased need in testing for the county and working on that contract with mentors and the county to bring that to us. It's something that's needed for our emergency workers and our first responders. So she can tell you where we're at with that. I know Rich was working on the contract for that, but we're also working on purchasing the equipment too. So with that, I'll let her handle that. That's her initiative.
Legislator Chesborough.
I do have a question about when you utilize the state fairgrounds for, and now that's just monitoring and decontamination
And registration.
and registration. Do you utilize the upstairs at all?
We utilize the upstairs only for monitoring and decon. It's a throughput. People come in, they get registered, deconned, or if necessary, and out the door they go.
Okay, my question is because there's 800 beds up there, it would seem as if it's something that we could utilize better in case of any type of evacuation, that we could utilize that.
We don't use it. The Red Cross handles that piece of the plan with the primary care, so we don't want anybody staying there per se, only because if there was contamination or radiological, you would have people staying where the radiological components are. So
Okay,
we have primary care facilities outside of that area that are established based on the need too.
okay.
So, I mean, we have to figure, I think, 10 or 20% of the population in the county would potentially go there. So we would only be looking at, from the 10-mile EPZ that now is about 40,000, but we figure at most would be 8,000 people will potentially pass through that facilities. They're not required to go there, it's just a recommendation on our part.
Okay.
But this way we have a better handle on the registration process there. But the absolute minimum, or I should say, upstairs, we only use one portion of it now. We used to use the whole upstairs.
Okay.
We only using one area that is in the, I think, the south corner of the building now. But there is all that bedding up there,
Right.
all those beds. But yes, nobody gets to stay overnight there. It's not a bed and breakfast.
Okay. Yeah, I figured it would be that. My second thing is that there is no heat upstairs, and I don't know if that is something that I don't know who would look into. If this happens in the winter, you wouldn't be able to use the upstairs
Yeah.
because we don't have any heat or anything.
The only heat that they have is in the downstairs.
Is the
which
downstairs? Is
Ron
it
put in there.
right? Is there a need, or is there something that we should do or they should do in order to have heat upstairs because of it? It could be something that, gee, now we can't even use it because it's cold.
Right.
There's no water, there's no heat upstairs. Is it something that we should look into to fix or to?
I'm pretty sure that Exelon probably won't spend the money to put it in up there. If they didn't do it originally when they put it in the downstairs. We could always move buildings if there was an issue in general. We've looked into that on other occasions of utilizing another building at the fairgrounds.
Or potentially getting whatever equipment we might need, so
Some
if we
salamanders or
had
something like
yeah,
that.
or if we
Okay.
had
Temporary.
because it's the showers upstairs, right?
Yeah.
Yeah, all the showers are upstairs and
Yeah,
you really would have to have the water's all turned off for upstairs because they can't because there's no heat.
And one of the biggest things that our best initiative is we always try to move people early. We try to move them before that contamination level is so extreme that it would require showers. So we try to keep these two stations downstairs now, which it would be a dry decon, which is basically pretty much it removes by just using a wet wipe. And then we're using the bathrooms downstairs now.
Mhm.
And then an extreme case would go upstairs. So we're really trying not to use the upstairs any more than we could.
Okay.
We also have our contract with the state fair expires in 23. And so at that time when we redid the contract last, which is usually a 5-year contract, they had made indications that they potentially didn't want to store our equipment there anymore because it's a liability issue for them if there was an issue with like flooding or something like that, that they would be responsible for all of that radiological equipment in there. So I'm curious to see what the 23 contract looks like.
Okay.
They've asked if we would be interested in another building, and while we would be, but we still need that shower capability, and there's not a lot of buildings there that have that.
That's the only one that really has it.
Yeah, other than the expo center, and we knew that we wouldn't get that one.
Minimal. No, and you don't really have the showers in there that you would need like they have
Right.
there.
Yep, so it's something that we're looking at. We're also looking at if they decide that they don't want to renew that contract, where would we go from there? So it's something to consider in
Okay.
general.
Okay.
And their emergency operations center will be open as well. So, Onondaga's emergency management, if there were additional things that we need, that was part of our partnership with them. Like, we have this issue, we need to find out how we can solve it.
Yeah.
So,
Okay.
Portable showers potentially.
yeah, we're gonna call Shane and ask him to send a team and a hose.
In years past, they did use like the fire companies, not for people, but for their vehicles.
I mean, experience.
Yeah.
Okay, but I was just curious about the heating, if there
Yeah.
was somewhere we could get funding to have it, so you would have that.
It would
as
be
a-
nice to have as another piece. Honestly, we would love to get out of the youth building just because the stairwell issue, especially when we consider the fact that there would be a lot of wheelchair potentially
You've
showing
got
up
one
there.
elevator.
One elevator, and we've gone there before for exercises, and the elevator was out of service. And so-
It does that a lot of times during the fair as
Yeah.
well, so.
So, I mean,
Okay.
that's why we considered it, so we are even trying to find another building that might potentially work better for us.
Okay,
So-
all right. Well, thank you.
Appreciate it.
So, in looking at the EMS coordinator report, I held a meeting with the county EMS agencies to go over some changes and updates. One of those that I had mentioned last time was there are counties around us who are doing what they call low resource condition. So basically, they're holding alpha calls, anything that's considered a low priority. They're holding those until the ambulance agency of that territory is back in service. There was an overwhelming sentiment from our EMS agencies. They do not want to do that. They would rather be in this place where we're in, where they're potentially going and covering calls in other agencies' territory. So they're just not ready to, they're afraid of that one alpha call that really is a lot worse than it sounded. And they're not willing to take that chance. So we're not looking at that at this time. I did ask them some of the questions that you guys had asked before. I asked them to look at their calls and see if there are those calls that they're covering for another agency because that agency is stuck at a hospital. We have our county CQI meeting tonight, so I've asked them to kind of look and see if there's any calls that we're finding kind of fall into that category. And I did do some more investigation, Legislator Klein, about their pay scales. And over the last year, they have had to increase their pay scales for paramedics. What the one agency was very candid with me and said they've increased from 17 to 19 because a very green paramedic in Syracuse is making over 30. So they had to go up. So I quoted 17, it's actually 19 for some of our starting paramedics. I just wanted to make sure I gave you the right facts. As far as the testing, we did get approval from Chairman Weatherup to go ahead and look at this testing relationship with Mentor. I'm sorry that's not on the agenda, but I'll give you a quick update. We have chosen Q. It's a box about this big. The sample packet comes with a nasal swab and a cartridge. You put the cartridge in, you swab, and put it in the cartridge. 20 minutes later, you have a result. So I did meet with Mentor before Thanksgiving. They're looking at testing from 9 a.m. to 1 p.m., symptomatic individuals, county personnel that need to be tested, or first responders. They're charging us a flat fee per hour, which is $40 an hour, $160 for that time period, and they cover PPE. They're going to do it in their drive-through bay. People drive their car in for their allotted time. They swab in their car unless they need assistance. The EMT will be fully PPE'd, and then they can give them assistance. They leave the bay. They will be contacted with their results within the next 6 hours. Mentor does all of the reporting. Their supervisors do all the reporting that's required by New York State. What we don't have settled yet is the scheduling piece. We would like to use CDMS, which our health department is currently using, because it talks to the other vaccine components, testing components, etc. So we're trying to work that out. We need to get permission from Jin Chang for them to have access to their system in a limited way, so we can just do the scheduling. We're ordering 6 cart testing analyzers, so we'll be able to test up to 6 people every 20 to 30 minutes. So Q just set up our account. They're in the process of setting up our account this morning. I got an email before I came here. And then we'll be able to make our first set of orders. They have thousands of tests and hundreds of analyzers in stock, so supply should not be an issue. I don't think there's anything. Rich is in the process of making the contract for us.
They're signatured out.
You said it's $140 to $160 per hour?
I'm sorry, it's $160 for the 4 hours. It's $40 an hour.
Okay.
If somebody needed testing outside of that time frame, I'm going to pick on Kevin. If Kevin said, I need this telecommunicator tested at 9 o'clock at night, it's $125.
Okay. And the other question is the test accuracy. Any approximately?
It's very good. It's 97 or 98%. It's a molecular test. It's not a chemical test.
Okay.
So molecular tests, our accuracy is really very good.
Okay, thank you.
Do we know when that's gonna be?
I had hoped by this Wednesday, but so I'll let you know as soon as we can.
Rich is almost done with the contract, I know
Yeah, he sent us a draft and we just gotta tweak the scheduling piece because Mentor was gonna buy a scheduling widget to go on their website, but then they have to interface between Eclairs, and if we can use CDMS, it's gonna be cleaner, more standard, so a couple weeks. I'll let you know as soon as.
I called Phil this morning, tell you we have an outbreak in the jail.
Okay.
All but 2 of our female inmates have tested positive. I think we have 3 officers right now.
So the nice thing is they did qualify for community testing, which means they can take those analyzers and go anywhere we need them to. So they can come right to your
Yeah, that was
facility.
my question. That's where I was going.
Yeah.
Right now, I think it's gonna cost about $10,000 for this round of testing.
So back in the spring, I think it was, when you had your latest outbreak, that's when Renee and I started talking about what can we do to help your situation. And then it
Yeah.
was, well, I don't think we can come to there. But then Hooley had some issues, so I was like, well, how can we help them?
Yeah.
So
Well,
I think they covered all the bases of what we started out for now, so they'll come to you.
I
we can
think we're in a
probably,
situation where we need to test the corrections officers because honestly, and I've expressed this, I'm gonna meet with the doctor and the health department, but I think it's a waste of time to test the inmates. What do we accomplish? We're not gonna do anything different.
Right.
If 90% of them test positive, we're not gonna do anything different than we're doing right now. We're not gonna tell them to go home and quarantine. We're not gonna, I mean, with staff is a different thing, because we don't want staff taking it home to their families and spreading it in the community.
As soon as
Well, and
we
you don't
get
want
the
your
test-
staff spreading it to other pods either. I mean, you want to keep it.
We have no way of controlling that. I mean, there's med passes, there's state mandated, there is no way to control it in a correctional facility. I mean, there's food, there's med passes, there's
Mhm.
court dates, I mean, it is what it is. The only thing we can do is keep staff from taking it out to the community.
As soon as we get tests, I don't see there's any reason why we can't start with you guys. I mean, we have an hourly price. So even if they come to your facility and they're not ready to start the public symptomatic piece, I don't see why we can't. So I'll let you know as soon as we get tests.
I think for this round, it's probably too late, because
Probably.
we have to do it, but it's my understanding Dr. Newpop wants to wait about 4 days and retest again, so maybe
Okay.
we could get some of the staff in there at least.
This is all symptomatic or asymptomatic for testing?
So for the public, symptomatic. If a first responder had a potential exposure, county employee has an exposure, doesn't want to take it home to their family, go to Mentor, get tested, etc. The legislature still needs to make a decision. I believe if it becomes mandatory for the 100 employees or more, that this is going to be the location that county
It's on
employees.
hold right now, unfortunately, so.
But
That's
we
a
would have the
decision.
infrastructure in place that we could potentially do that if we,
So this is initially not for community testing, it's for our own people.
it is for community testing.
Oh, okay.
So a Fulton family of 6 can go to Mentor and get tested. Right now, the Pulaski Urgent Care Testing Agreement
Right.
is for staff and students only.
That are
So if you have a
symptomatic.
student that, yes,
However, this is going to, our people are going to take precedent. Our employees will.
yes, you have access.
Well, I mean,
You have
part of it is,
24/7 access if you want it. You're just gonna pay $125 to get a test at 9 o'clock at night. Or you can go at 9 o'clock and go,
9 o'clock in the morning.
right.
Just a quick question. You said family of 6 can come get tested. Is there an expense to them?
No.
No.
but we
This is
bill
all
for
free testing.
insurance.
Correct.
They're going to bill their insurance though, right?
No, that was not discussed. My understanding was this was ARPA funding. So there was not insurance billing.
We got Dr. Rich.
That's not part of the draft agreement that I received.
Okay.
I can
I'll
tell
find
you
out about it.
that we are having our people bill their insurance when we send them for testing.
Okay.
Because we had one person who doesn't have county insurance that we need to figure out how to pay for it.
Okay. We'll get that cleared up.
And even if we can drop the community piece for the time being, we need something today.
Yeah.
I mean, been asking for this for months and months, and the sheriff's, willing to help me out. But I mean, at the moment, health department's telling, there's nothing we can do for you. You need to just get in line with everybody else. And frankly, 911 can't afford to do that.
Right. Well, for our own people, we're self-insured anyway.
Right.
So
Mhm.
if we pay for one way or the other. It just-
But if we're going to the community, I mean,
The community should be.
Yeah, if this is open to the community, I think we should prioritize the first responders in some way.
Mhm.
Because
So-
we have to keep our systems running. I mean,
Right.
Without that, we're kind of screwed.
Sure. So Mentor has said, you have a time slot, you can fit 6 people in, right? But for HIPAA compliance, you won't invite 6 different people in. What we're saying is we can do 6 in this 20 minutes. You and your family of 4 can come in together and get tested. Well, maybe one of our employees says, look, I need a test. All right, well, I know I have 4. I have another analyzer available. I'll meet you at the front entrance, swab for me, and then, you know what I mean? Mentor is going to be good to us. So yes, your community or your county people who are going to get tested, who need to get tested, will get tested.
Yeah, continue. I'm curious why we can only do 6 people an hour if it's just a swab.
So,
Just curious on those numbers, because that seems
That's all we
pretty.
have.
well, we bought 6 analyzers.
Oh,
that's
okay,
why.
because we only got 6 analyzers, okay.
Yes, you can buy as many analyzers as you want, but we started with 6. They're $200 a piece. We thought that was a good initial investment to see how this rolled.
how much were they?
$200 a piece.
But you said 6 every 20 minutes, right?
Yes.
I think we should get, well, let's see how they pan out, but I certainly think we could probably use more.
Happy to
Yeah,
bring it
yeah,
to
yeah,
you.
right.
So Mentor's going to provide us a report weekly on how many individuals were
Let's see what
tested.
happens the
Yeah.
first week.
And so you can see, is the community using it? It's not walk-up testing yet because they don't want symptomatic people in their facility, like in their training facility. They're working on walk-up testing, so it's drive-through testing right now. That's an eligibility issue initially, so you're not saying it's open to anyone. So we do have to be careful about equitable.
Well, the biggest concern right now is we have our whole public safety infrastructure that needs to be up and running. And when you have, 911's pretty brittle right now.
Yep.
The
Agreed.
jail's pretty brittle right now. So we need to keep these
Yep.
people testing and moving them forward.
Yeah.
You know?
And I like that you can find out in 20 minutes and not 3 days.
Is there a means of putting one of the test machines in our jail?
Yeah, we
And
are
having-
making the account with Q. We could buy 3 for the jail. We could buy 2 for the jail.
There you go. That makes sense.
So can a
Yeah,
doctor,
that's-
We have
can
medical
you do-
staff.
Right.
You have
their
medical
medical
staff
staff
that can do it.
administer them?
The results piece is the issue. So when you do that result, it has to be reported to eClears within 24 hours. So
Yeah,
that was the nice
You don't
piece.
have medical
Who-
staff, right?
What's the qualifications to
What?
administer these tests?
No. It's an over-the-counter test. So most people are buying Q over the counter. So anybody can do it.
And so if we had this test mechanism in the jail, we could test county employees if we hadn't done that. My concern is, I can, as people are working, I can test them while they're working.
Mhm.
And pull them offline for, 5 minutes to do it. But
Mhm.
if I have to send them to.
That, I had the same concern.
Yes.
So
Yeah.
if it's in our building and we have medical staff there that can,
You just have to have that, so you have to
You're
have
in the
the
same building.
So,
reporting.
but,
So that would
I
be a
mean,
win-win
between
all
the two
around.
departments, how many people realistically, let's just do 911 and the sheriff's now, I mean, what? We're talking 150 staff members in total?
Although I'll send any of my people down to jail, that we shouldn't have to test every other day like there.
Just the reporting piece. We need to figure out the reporting piece, and y'all can bring that to Jin Chang. I don't want to be the messenger on that one.
Well, it certainly seems like it would be more efficient to have you have. the
Well, I
machine
think
there.
we need
right
it.
there.
Yeah.
I mean,
No, no,
it's just a swab, we can send medical staff, have them go up the elevator, they don't even have to leave their facility.
And it should be limited.
Mhm.
It really shouldn't be,
We could buy 2 analyzers and keep one in 911 and one in the
Right.
jail.
I think we're gonna
Well, why don't they just bring the
You shouldn't
swab
be
back
that
down
way.
like you say?
They
I mean, and then they can go to probation if they need to,
They
too.
can.
Oh, yeah.
Yeah.
We just had 3 positives over the weekend, and we have another one going this morning to be tested, so out of our small staff, we got 4.
Nobody cares about the fire department section.
Well, no, all the fire departments can use mentors
Oh, yeah.
because they're on the road anyways, you
Yeah,
know? I
they
mean,
can.
it's not like you're in a standard.
It's a pretty decent.
Which is better than putting them in line with everybody else, which is what we're doing.
So-
right now also.
Right.
Yeah.
So there's a lot of great ideas, and that's what, a lot of great ideas are born out of this committee, but I don't think it's the committee. I don't think we're going to accomplish much by kicking all these ideas around. Renee and Don and Dave and Kevin have heard all of our concerns and ideas. I think now it's going to be up to them to move in the right direction of what the committee's looking for. So I'm not trying to stifle discussion, but at this point in time, I don't think we're going to accomplish too much. There's a couple questions we got to do, but I think you understand the committee wants to see that we can take care of our public safety infrastructure employees, if you will, moving them forward. So, sounds good.
Just
Thanks for that
Bill
support.
to approve the PO.
All kidding aside, Shane, you're comfortable with the capabilities that they have at Mentor to cover your people?
Same thing with EMS. EMS is going to be able to do that as well. So if you have an oops, my mask broke, then go to Mentor and get tested. We save your crew and your people that are sharing that living space with you for your shift.
I've worked with Zach on many occasions, and he will definitely go out of his way to take care of us. So, and that's with any of us either. So,
Great. All right, moving along. If we're done with EMO and EMS,
Yeah.
all
That's
right.
my big
Probation, you're up.
Don't really have a lot to add to what I have in my report. Our caseload numbers are staying about the same. My major thing is staffing right now. I've got 4 probation officer positions on finance and personnel for Thursday. My restitution clerk went to another department, and now that I've got a few cases of COVID, they're going to be out, so it's getting really hard to cover caseloads. Which kind of brings me to a question. When somebody's quarantining at home by order of public health, are we allowed to have them work at home at all because they're being quarantined? I mean, like, if we have people that have investigations due, that if they're not,
feeling
then-
okay, right?
I think they're, yeah.
okay. I didn't
If
know,
they're
because
willing
of
to.
quarantine, I didn't know if technically they're not supposed to actually be working from home.
Get work out of them, that's.
Well, that's our problem.
As long as they're feeling well, I
Okay.
thought that was the case, as long
Okay.
as, they were.
I just want to make sure. They've got reports that are due, the courts are going to wait on them, and then they're home for 2 weeks. So.
Just make sure that you know it,
Yeah, oh yeah, yeah,
and if they're not.
sure.
Legislator Trudell.
Just down through the list you got, which is very, very good. I appreciate these reports that come out with the cognitive behavioral intervention grant.
Yep.
And for incarcerated individuals are participating, blah, blah, blah. What do we expect to get out of that?
Cutting down on recidivism, so people when they get out of jail, hopefully they won't come back through again.
And it says 4 are participating in it,
Yeah.
and it's voluntary.
It's voluntary, and we have to make sure that their incarcerated people are going to be in jail long enough to do the program, because it's kind of a lengthy type program. So
Okay.
usually it's people that have been sentenced to a period of time, not just like a person who's just in there on an arrest and could get out in a week or whatever.
You know, it is a grant, but in your estimation, it's worth the money we're paying for it.
Yeah, but we wouldn't, I mean, we're not paying anything as far as the county, but it's
Well,
their
I
cost.
understand that, but I
The
mean,
state,
it is,
right.
we are
Yeah.
paying for it, just not directly out of line.
I think it's a very cost-effective program, and
That's-
actually, the state tells us the same thing too. For what
Good.
they're giving us, they get a lot of bang for their buck for their program, so.
That's exactly what I want to hear, and if it's not, we want to hear
Sure.
that too, because, we want to take the grant money, but by the same token, it's something that's not effective and working.
Absolutely.
We don't want to, but if you say it is, I'll dig at that.
Yeah, I like the program, I think it's good.
Have you been through it?
No, I know what they do with people.
Okay, very good, though, that's the other one, thank you.
Legislator Klein.
Yes, Dave, I asked you a question about your staffing, and you came up with some good reasons, and I think it'd be worthwhile if you could just reiterate to the committee what you told me, because this is something we have to be aware of. What's going on, because probation, and I've been on here since the first day of legislature on this committee, we never had a problem with staffing probation. We had a problem with probation taking people from social services, that's a different
We
issue.
still do.
Now we, yeah.
More now,
if you could just reiterate that, what you told me, please.
As far as staffing going,
Staffing and why?
yeah, we've lost a few to Onondaga County probation because of higher pay. But the rest are retirements as far as what we've lost recently. But, yeah.
You know, because here's the thing, and we can't keep kicking this can down the road or ignoring it or putting our heads in the sand. But now we got counties cannibalizing us bad. And it happens to be our sister county. I'm sure Cuyahoga County will do the same thing. They get away with it. The key is we got to look at what we're paying our people because we're losing people that have experience. And I know you guys don't like to hear it. I know not any of you work in private this, you're looking around. It costs a hell of a lot of money to train people. It does. And we've got to look at this and really look at it at the face value of why we're losing people. Because I don't know if you know what the unemployment rate in other counties is and around us and the whole state. It's not great. I don't care what the figures showing national and how they hide it from the administration we have now. It's horrible. Just to be aware.
Kevin, you lost people to Onondaga County as well.
I will remind you, Legislator Klein, we can't just throw money at a problem. There's negotiations and unions involved that we have to go through.
No, we can't throw money at the problem. We just gave Oswego help a hell of a lot of money to retain people. And they're not us.
And that's what union negotiations are for. So we'll move forward and hopefully when we get to those negotiations, we can have a plan set forth with them. So, all right, Fire, you're up.
Stop, I apologize, sorry that wasn't with the packet. I'm still trying to get adjusted to the timeline,
So
so.
don't worry, we're keeping score.
All right. How many checks do I got?
This is your last one.
That's the last one? All right.
Next month you'll start with a new chairman, so
All right.
you have that clean slate.
All right. Held confined space training in Fulton back on the 21st. There were 14 participants that took that class. Working into the budget, hopefully. I conducted battalion meetings. I've got 3 done. I've got 1 more next week. One of the ideas that we came up with was to have each battalion will get a day at the fire school to practice, to do what they want to do, throw scenarios at them. It's early planning. I just started talking to the chiefs and the battalions about it. Seemed to be good reception back on it, but obviously a lot of that hinges on the budget. So the ERTC staff that's been on there a couple of times, I just sent attached is the job description from the state, for the state fire instructors. I don't hire them, they're state employees. But I just want to give that to you so you've seen it and know what they're looking for. The deputy coordinator position, I haven't had any feedback yet on the changes that I proposed. I've still got to meet with Battalion 4 next week. After that, I'm hoping they put that completely forward. I started working on the county mutual aid plan, and I met with the state in regards to the arson control plan. And that's going to be a lengthy process. That hasn't been updated since 1981. Fire investigation team, we're going to have to come up with policies and procedures to bring that up to date, so that's going to take some time. A lot of the next stuff, Radio 911, is more or less for the fire chiefs, I apologize, but basically radio programming, working with Kevin's office. One of the things that we started it earlier than January the 20th of 2022. One of the things I changed for the fire investigators is we've got a few people that are learning the trade, and in order to do that, they've got to get to the fire scenes. Well, we haven't been utilizing them to the best of their ability. So one thing I worked out with Kevin and his staff is that it's already started, is that anytime there's a working fire declared, the fire investigator is dispatched right along with the other resources that come along with that. So we've had a couple fires since that. It's worked out well. We have a few bugs we've got to work out, I think, with the sheriff's department when they're notified, but we'll work through that. I met with Phil in regards to the AFG grant, the Assistance Firefighters Grant. I had some ideas on how to start replacing our high-end items like the mobile cascade unit, the mobile command bus. I'm still trying to get figures together with that. Phil kind of filled me in on what we can and can't do as a county. So I'll have more on that hopefully next month. And that is pretty much it, unless you have questions.
All right, moving right along to 911, thank you.
So the report is attached. You'll see our emergency calls answered within 10 seconds is still way down with almost 11% below the national standard of where we should be. Directly correlates to our personnel staffing issues. So that hasn't gotten any better, but luckily it hasn't gotten any worse since our last meeting. So we have started trying to shed some our tasks that aren't emergency related, getting the villages and city PDs to answer their own non-emergency calls, as opposed to taking and forwarding them all over to 911 and having us take messages and get that information back to them when they're sitting in their stations. So those we've pushed back on those agencies a little bit, which is something that we've been doing for quite a few years. So if anybody hears any grumblings on that, that's because of our staffing issues. But just to kind of go back, our 2019, I've been mentioning our workload is increased substantially since COVID has really hit. In October of 2019, our 911 calls answered were 819 landline calls versus 1,657 in October of 2021. Our wireless calls, 2,735 in 2019 versus 4,914 now. 7-digit, which is alarm companies and non-emergency rollovers, 1,458 in 2019 versus the 2,276. So we're seeing almost a 50% increase in 2 years, and it's just been a steady incline. So for us to be carrying that workload with the less staff is pretty amazing, to be honest with you. We do have a lot of dispatchers that are on the phone, which is, then taking their attention away from their dispatch responsibilities. So, we're trying to handle that as best as we can. Obviously, one person can't do two things at once, and so there are some times that some non-emergent stuff on the road we've had to push back a little bit on, but to date, the supervisory staff that we've been working with from the end user agencies that has been working with us. But to have that substantial an increase and to not increase staff, but to see a decrease in staff is very alarming. And that doesn't seem to be going down anytime soon. I kind of expected maybe as we went into fall, that curve would finally start coming down, and it hasn't. So pretty much since May of 2020, we've gone up and are just steadily climbing. So I was hoping with the alpha calls on EMS that was going to be helpful. EMS community didn't take to that, so we still continue dealing with that. The non-emergency calls, like I mentioned, for law enforcement, we push back. We're looking into some options to try and help out on the medical side, because some of our medical calls that people feel are emergencies aren't emergencies, and if we could try and stave those off in the beginning, it would help the whole system on the back end. So we're looking at some options there as well, with our partners, across the consortium. Onondaga's got a RFP that they put out for a nurse line that lower level calls will actually go to this nurse line after we get to a certain point in the emergency medical dispatch protocol, and they will actually determine if they need emergency care, or if they can do a telemedicine visit, or if they just need a ride. If they just need a ride, part of that program that they have set up is they'll dispatch an Uber or a Lyft to the residents to be able to take the person to urgent care or their doctor's office or whatever it may be. So we're looking at that because a lot of those we're sending ambulances, and then the ambulance is taking them to the hospital when that may not necessarily be the best bet. So we're looking at that as well on the EMS side.
That was well
So-
received by the EMS community. They really want to keep their eye on that and see what's happening in Onondaga.
Yeah, so if we can take it and not make it a dispatch issue because we don't have the resource to send, not make it an EMS issue because they're pulling ambulances from other areas, and then not making it a hospital issue because we're not sending the ambulance to sit and wait at the hospital, that really does make a lot more sense in the big picture. So we're looking at that program, looking to see how that comes together for Onondaga, and we'll go from there. But beyond that, pretty much just wanted to say thank you for the support over the past year. I know this committee is very involved, and appreciate all of your help and working with us, especially Chairman, since you're going to be leading us all together. Thank you.
Sheriff, you got anything?
I do. Actually, let me address he brought up a point of when we have dispatchers working as call takers too. I'll give you a specific example of how this gets dangerous. The other day, the shooting we had, a female shoots her boyfriend. I don't know what the relationship was. The victim's down in front of the house. Troopers and deputies responding. The first trooper on the scene had no idea where the suspect was. The dispatcher was asked to reach out to call back to the suspect inside. She was physically unable to because she was dealing with all the units responding. So it ended up being a deputy working the desk had to call and tell the trooper, whoever's knocking on the door, get away from the door. She's the other side of the door with a rifle. It becomes a danger issue when we have dispatchers working as call takers and dispatchers.
Mm-hmm.
Eventually, it's going to lead to a bad situation. And we got lucky in this one. Mm-hmm. The sergeant working the desk was bright enough to realize that the dispatcher did not have time to call this suspect and negotiate with her to put the rifle down. So something needs to be done, because now it's not just a scheduling issue, it's a safety issue. That we have units responding that they're just overwhelmed.
When you talk about trying to get it, if they only need a ride and how to get them there, have you talked to the mobility manager with Oswego County Transportation yet?
I have not.
Okay, please do, because they're getting really a lot of the volunteer transportation people that can get
Okay.
people moving.
Currently, I have no way to shunt somebody to a non-emergent.
Okay,
Our current protocols, you're going to get an ambulance or you're going to get some type of public safety.
right,
So that's what this other program
right.
takes, because we're not medical professionals.
Right.
So we would need a medical professional to make the determination
Right.
that emergency response is not needed.
Right, once you get to that though,
Yeah.
utilize mobility managers, because they're really doing a lot with this volunteer transportation and stuff that can help you out.
Transportation will be a big piece of that.
Yeah.
We're in a much different geographic situation than Onondaga is, so that will definitely be one of the big pieces of the puzzle.
So we might need to do a whole new, like, public service announcement type thing with this, if we change, because this could really help and change 911 altogether. I mean,
There's other things that we're looking at, and yes, we're looking at a tiered system where we put advanced EMTs in ambulances. Not every ambulance is a paramedic anymore. You're not going to get a paramedic anymore. So you might get an ambulance that has to call for a paramedic. Like, there is systematically going to be some changes in how we address emergency calls. So it will need to be a public information campaign.
Richard, do you have your hand up?
Yeah, I got a question. Kevin, who makes this determination of whether it's what kind of medical emergency it is, if one at all?
Our emergency medical dispatch protocol, our ProQA software, that actually asks a whole bunch of different questions, and it's based off of the answers to those questions. It tells us what level, what tier it is.
Does this take time to do that while the person's on the phone?
It does take time, yes. Yep. I mean, on average, we spend about, I think it's a minute 19 on every EMS call, on a standard average EMS call. Some of them were on the phone until the ambulance shows up. CPR the other night, I had full arrest in Hastings the other night, and 911 was on the phone until I arrived on scene and to tell them that they could disconnect. And the caller couldn't do anything. The person unfortunately was lying on their face, and she couldn't roll him over. So, we're tying up that resource. We can't just hang up on the person, but then there's other sides where, it's the person that knows, okay, yep, I got chest pains, I can't breathe, and I can't talk, but you're talking to me right now, I really need an ambulance. And so we get off the phone with them quickly and roll it over and keep with them. So goes on both ends of the spectrum, but it's the last report from October, it was a minute 19 we spent on average on the phone. So for EMS.
So those questions and those determinations are also reviewed by our medical director that EMO, EMS, and 911 employ. So they review those to help make those determinations. So the vendor has a quality assurance review side, but we also have an internal one. So somebody who's known preeclamptic pregnancy becomes a higher priority call based on the information from our medical director.
Good. Any other questions? Anything else from you, Sheriff? We kind of went off on a...
No, it's just real quick.
Mark?
If I can, before we leave, thank everybody for this year of their service, and just want to recognize Legislator Trudell and Wilbur, who won't be with us in the coming years, and say thank you for all their hard work and dedication to public safety.
I would like to, just as chairman for the past 3 years, I've really enjoyed this and being a part of this great team. I think we've made leaps and bounds in the right direction. We have pretty much all new department heads since I've taken them. Well, we have, except for the district attorney, we've had all new department heads under public safety since I became chair. So that's great. Well, you came in about the same time I did, so that was great. And I think you're doing a heck of a job. And truly, some of my proudest moments as a legislator come from this committee. So thank you to each one of you. I know that I'm definitely leaving the county better than I got it, and I know this committee puts their heart and soul into this topic. So thank you to each of you. Legislator Klein, do you have something?
Yeah, the sheriff was just walking in. I got a question. Sheriff, just a quick question. All I know is what I hear in the media and what I...
Well, don't believe it.
I'm sorry.
Don't believe it.
Okay, well, I thought they were saying good things. Are we having, or it is we, but your department, your deputies, are we having a problem right now with an increase in problem with fentanyl and the marijuana and the drug overdoses and things like that? I mean, it seems to be a real problem all over, and I don't think Oswego County is a hell of a lot different.
We had an increase in overdoses, but we haven't seen anything where there's fentanyl and marijuana yet. We haven't had that issue. Really, in our county, it's in Maui is our problem. But in Untitled County, they must have had a bad batch. They had 14 fatal overdoses.
Yeah, I live along the county line, so I mean, it's right there.
Okay. I'll entertain a motion to adjourn.
So much.
Second by Legislator Trudell. Thank you for your service, Legislator Trudell.
Indeed.
And, your years as my vice chair, it's really been a help to us. So all in favor of adjourning, say aye.
Aye.
Any opposed? None approved.